So as you know, this was the area that was fractured so badly. Okay, absolutely, the L3 vertebrae. We're just starting off with x-ray, so we haven't done anything too exciting yet. You've probably seen all these already. So this is the L3 vertebra. And you can see he's put, screws in 3 levels up above, 2 levels down below to hold you together. Now the curvature of your spine is pretty nice. You still got some curvature in there.
See, he was worried because it was like more curved and then it was straightening.
That's what we worry about over time. The reason he wanted to do this is so that you didn't get to this position when you're starting to tip forward. Because we see that all the time. That could be a problem, 20 years from now, when you're still a young person and you've got a really stiff or flat back. This looks pretty good for right now, considering the fracture you had. Now, what we're talking about with this kind of bladder changes and the kind of the lower extremity symptoms is something called a tethered cord. And what we mean by a tethered cord is anytime the spinal cord ends lower in the spinal canal than it's supposed to. So this is the spinal cord coming down here in the spinal fluid sac. Does that make sense to you guys? Usually it ends right here at L2. In your case, yeah, usually in us, it ends right here. Okay? When we say tethered, we mean it's laying lower. Okay? It's down here further than it normally is. And there can be all kinds of reasons for that. In your situation, what is likely doing it is there's a little collection of fat within the spinal cord itself, very small, okay, called a lipoma, that is probably going ahead and holding it down there. The thing is, though, the spinal cord is now in that position. So if we were to go in there and, if you will, get out that lipoma, it's not like all of a sudden the spinal cord is going to shoot back up.
Right.
It's not quite that simple. Okay? Where we see it on the other images, let me pull up a cross section. So now I'm going to slice you like this, okay? Right over there. Put this right here. So now I'm slicing you like, again, crosswise. Now it's hard to see with all those screws and rods in there. Let's go up to a normal level. There's your spinal cord right there. Okay? That little almond. This is the front of the spine. This white stuff around it is the spinal fluid. So that's sort of the spinal canal, spinal cord running inside of it. As you go down here, what I want you to do is look at this thing. And it's going to be hard to see. But see right there how there's like a little tissue coming out of it? That's a lipoma. It's coming out more to the left side, okay, at about the L2-3 level.
Sure.
Okay? Now, if we were to go in and do something, what it would entail is going in, open up the covering of this spinal fluid, and trying to clean out as much of this as we possibly could without getting into the spinal cord itself. That's where the problems occur, because you're manipulating the spinal cord and the nerve roots around it. So you don't know sometimes until it's too late what's normal tissue and what's fatty tissue.
Gotcha.
It's impossible to tell the difference between the two. So yes, you have a tethered cord, but unless somebody's really going downhill, do I recommend going in and doing something about it? The answer is, to be honest with you, no. Okay?
That sounds better to me. I agree, because like...
Okay. Sounds like you may have made up your mind already.
Or she just didn't know if it was something that was going to get...
worse, like, that was one of my questions, is like, okay, so Seth, my impression after talking to him this last couple months was once they get it out, then it will be fine. But then I'm curious if, like, the longer we leave this tumor or lipoma in there, is it going to continue to cause more damage? And is that damage irreversible? Or is it going to be okay once it comes out?
Usually what will happen is if we let it go too long, say for instance, you blew it off for 15 years, didn't follow up with anybody, you were starting to trip over your feet all the time, wear braces, use crutches and stuff like that, and then go to a wheelchair. That would be too late, okay?
Yeah.
If we see you every 6 months and you say, well, yeah, my foot's getting a little weaker, and we notice some changes, then usually no, it's not too late. Okay, so I follow people pretty regularly, every 6 to 12 months with this type of thing, to see if they're getting worse over time. That's what I would recommend.
Sure.
And are there tests we can do to try to determine if the bladder's getting worse and the nerves are getting worse? Yeah, if you start reporting things are getting worse, we're going to order those tests. It's going to...
Now, how does that cause, when you have that fatty tissue in there, how does that relate to infections?
What it does is the bladder doesn't work correctly.
Oh.
So there's the problem. I would prefer, okay, to not charge in for the reasons that I've said. I've said it 15 times, probably the last 45 minutes talking to you guys.
Well, and that's exactly how I feel. Is I just felt like I don't think this is severe enough to affect my everyday life where I'm like, I want to have another surgery. Because I think any spine surgery, just the recovery alone is enough to make me want to be like, no, I don't want to do that. But also the risks of being worse than I am.
If you'd have to do surgery on something like this, how invasive does that get in a project?
It's pretty invasive surgery, so it's not something you do, really.
Especially with
Especially
the hardware and the way.
Exactly.
Yeah, that's what I'm
So
just concerned about.
Open up the covering of the spinal cord, use the microscope, and sometimes we'll use a laser to try to debulk some of this. Sometimes we'll just use a little, what we call ultrasound device to try to kind of aspirate it out.
Yeah, sure.
We use different devices to try to clean it out a little bit.
Sure.
And so, depending on what works, and try to kind of get the fat down to the smallest layer. Sometimes the laser hurts the cord, sometimes it helps it. Sometimes the ultrasound hurts it, sometimes it helps it.
Sure.
And so everybody's a little different. What we're trying to do is anything that is sticking to that tumor, okay, I call it a tumor because it's a lipoma,
Right.
Yeah.
but it's about
If you do go into surgery, what kind of rehab is it completely?
kind
Is it
of,
all
Rehab
over
isn't
again?
similar to like her back was broken.
it's not quite as bad as that, but it depends on what happens at the time of surgery.
Mhm.
For instance, if there's any worsening of your nerve function, then there's more rehab involved for
Yes.
that.
Right.
Okay, so if that's at 20 to 30% of people that can get worse, that's a big deal.
Yeah.
Exactly. I say
see
leave
this.
well enough alone.
Yeah.
Leave well enough alone. If you're getting by with it, which literally, you're doing better than looking at your scans. You're doing a hell of a lot better. Excuse my language.
Yeah.
And I thought you would be. Okay.
Yeah.
So I'd leave it alone as long as you possibly could.